Hello, we are nursing students from Houston Baptist University, and we're here to teach you today a little bit about human immunodeficiency virus, also known as HIV and AIDS. My name is Emily Hobbs.
Victoria Harris.
Maria Hernandez.
Yesenia Hernandez. So the definition of HIV is that it's a fragile virus that is transmitted under specific conditions that allow contact with infected blood, semen, vaginal secretions, and breast milk. HIV is a global pandemic. It's killing more than 25 million people a year. The presence of a new disease in 1981 was discovered. In 1985, the causative agent HIV had been identified. AIDS, also known as acquired immunodeficiency syndrome, was determined to be an advanced stage of chronic HIV infection.
So for epidemiology and stratifications, in North America, the epidemic is growing at its fastest rate among women, people of color, those who live in poverty, and adolescents. Other groups that are particularly at risk are gay and bisexual men, as well as substance abusers. Some pertinent geographical information issued by the CDC states that the concentration of HIV and AIDS patients are in urban areas. In 2009, the number of people with AIDS was most in the South, and in 2010, the Black population accounted for the largest proportion of AIDS diagnosis in South, Northeast, and Midwest.
Relevance to HBU community that HIV/AIDS has. In the student handbook for the policies, it states that the Public Health Service says that there is no risk created by living in the same place as an infected person, casual kissing, or swimming in the same pool with an infected person. At Houston Baptist University, there are two policies regarding HIV/AIDS. One includes the individual's rights, and two is the policy implementation. The individual's rights of all people in the HBU community shall be safeguarded, therefore stating that the uninfected should be protected from undue risk of exposure to the disease. The infected should be protected against prejudice and denial of the reasonable opportunity for an education at the university, and the university condemns any and all actions of physical or emotional harassment toward the infected or those suspected of infection. The second, the policy implementation states, as above, the current medical knowledge indicates that people with HIV infection do not pose a health risk to others in the academic setting. Therefore, until medical knowledge indicates a contrary conclusion or unless health regulations or other laws require a different response, the policy of HBU will conform to the following. Admissions. No otherwise qualified individual will solely be reason of his or her HIV or AIDS status be denied admission to the university. Their attendance, they will be allowed to attend regular classroom sessions. The university reserves the right to restrict a student on case-by-case basis if a student has contagious disease, or if the individual's behavior is disruptive or endangers the safety of health of other persons. And also the access to the university housing and facilities. This states that the students with HIV/AIDS will have access to the university housing and facilities. Restrictions will only be posed on the basis of medical recommendations. So some signs and symptoms. HIV, there's different stages. There's the acute HIV infection. The signs and symptoms, these will include, as you can see above, fever, swollen lymph glands, sore throat, headache, nausea, muscle joint. Some neurologic complications can arise from it. They usually will occur 2 to 4 weeks after the initial infection and last 1 to 2 weeks after. Signs and symptoms usually will be of seroconversion. This means that when the HIV-specific antibodies will develop. Signs and symptoms of early chronic infection. The interval between untreated HIV infection and a diagnosis of AIDS is approximately 11 years. This phase can also be called the asymptomatic disease. If the person will have symptoms, it usually will include fatigue, headache, low-grade fever, night sweats, and persistent generalized lymphadenopathy. Then in the intermediate chronic infection stage, this is also known as the active stage. Infections affiliated with this phase will include the most common oropharyngeal candidiasis, also known as thrush. It can also include shingles, persistent vaginal infections, outbreaks, bacterial infections, or also oral hairy leukoplakia. This is also an indicator that the disease is progressing. This is an Epstein-Barr virus that causes painless white raised lesions on the lateral aspect of the tongue. And then the signs and symptoms of late chronic infection, HIV, this is whenever it becomes AIDS. A diagnosis of AIDS is made once the HIV-infected patient meets the criteria of the CDC. There's a list of things that the patient must develop, at least one of them. And as you can see on here, it states that they have to have at least the CD4 plus T cell count drops below 200, or one of the following opportunistic infections, one of the following opportunistic cancers, wasting syndrome, or AIDS dementia complex, also known as ADC. So now Maria will be talking to y'all about the risk factors of HIV/AIDS.
Risk factors. You're at greatest risk for HIV if you have unprotected sex, and by saying unprotected sex, it means anal, oral, or vaginal, and not wearing a condom. Multiple sex partners. This has a very high risk because you don't know the status of your partners and they don't know your status. Also, STIs, sexual transmitted infections, can cause warts, which will only be an opening for the HIV virus to enter your body. And the use of intravenous drugs, sharing needles, and not being sterile when using intravenous drugs. Detection. HIV is most commonly diagnosed by testing both blood and saliva to make sure there's presence of antibodies of the virus. The cons of this method is that the antibodies are not effectively shown until almost 12 weeks after infection. There is a newer type of test that checks for HIV antigen. It's a protein that's produced by the virus immediately after infection. And the pros on this test is that it can be immediately tested for within days after being infected. Detection. The following tests will help your doctor determine the stage of the disease. CD4 count helps the doctor know specifically how many white blood cells have been targeted and destroyed by HIV. A normal count that a human should have is 500 to 1,000. After HIV has infected the body and the patient has AIDS, they will be around 200 white blood cell count. Viral load. This test measures the amount of virus that is in your blood. Viral load has helped some patients because it will let them know that they have the virus and they can right away start letting their partners know. Drug resistance. This test helps doctors know what drugs you're going to accept and what drugs you will reject for HIV treatment. Prevention. It's important to always use a condom when you're having sex, especially if you don't know the status of your partner. Use a new condom every time and make sure that you know how to properly wear a condom. There is a drug called Truvada, and the Food Drug Administration has approved this drug as a preventative measure for HIV virus for those individuals who are high risk of being infected. It's also meant to be used with other prevention methods and to be closely monitored by your physician. Know your status is really important. It's probably the most important thing, so get tested and ask your partners to be tested as well. Some other things that you can do for prevention of HIV is to be aware of your status and let your sexual partners know if you do have HIV. Your partners can then let their partners know, and you can prevent someone else from being infected. Also, using a clean needle if you do have an addiction to IV drug administration. There's support groups that offer to trade out your old needles for new. So make sure that you're not sharing and you're not using dirty needles. If you are pregnant, make sure you do see your physician right away. So that way, if you have HIV, there's methods that can help control the virus being passed to the fetus. And there's some studies have shown that if a male is circumcised, the chance of being infected by HIV virus is lower than the chance of a male who is uncircumcised.
For treatment and management of HIV, currently there's no current cure for HIV or AIDS, but there are a variety of drugs that can be used in combination to help control the virus. The antiretroviral therapy, most commonly known and referred to as a cocktail, is a mixture of different types of medication that keep the virus from growing and multiplying. Each drug does something different, so it's best to combine at least 3 drugs from two different classes to avoid creating strains of HIV that are immune to just one drug. So when to start the treatment, usually there's current guidelines that their doctor will follow to be able to start the ART treatment. Some of them are like if you have severe symptoms, if your CD4 count is under 500, if you're pregnant, or if you have HIV-related kidney disease, or if you're being treated for hepatitis B. HIV treatment regimens involve taking multiple pills at specific times every day for the rest of your life. Taking medications doesn't mean your HIV is gone. You can still transfer HIV to others. Because HIV targets the immune system, it's important to promote a healthy immune system. By doing so, HIV disease progression may be delayed whether or not ART is used. Because the immune system is weakened by HIV, it is important to prevent opportunistic diseases such as pneumonia, the flu, or hepatitis. This can be done through vaccinations or adequate ART therapy. Other useful interventions for HIV-infected patients include nutritional support to maintain lean body mass and ensure appropriate levels of vitamins and nutrients, moderation and elimination of alcohol, tobacco, and drug use, getting adequate rest and exercise, and reducing stress by either accessing mental health counseling or getting involved in support groups and community activities. HIV affects the different dimensions of health. For physical, you'll experience the signs and symptoms of HIV as the disease progresses. You'll also have to go through drug side effects. For emotional, there are very emotional problems related to HIV, such as anxiety, depression, low self-esteem, or grieving. For intellectual, there's also adherence to the ART therapy, which, as we said before, you're taking medication every day for the rest of your life. And there's also decisions about treatment and care. As well as environmental, you're also at risk for infections because your immune system is so depressed and very susceptible, and you also might have to deal with social isolation. For sociocultural, there's caregiver role strain and also negative stigma. And in spiritual, there's might be feelings of guilt, blaming, or powerlessness. So for support, there's a wide range of services and resources available to people with HIV. Most HIV/AIDS clinics have social workers, counselors, or nurses who can help with problems such as arranging for transportation to and from doctor appointments, helping with housing and child care, dealing with employment and legal issues, and seeing you through financial emergencies. There are support groups available in the Houston area. There are women-only groups, men-only, all-inclusive groups, Christian groups, and social groups, as well as online dating for people who have HIV. The list of groups and the time that they meet can be found in the City of Houston website.
Some of the rehabilitation goals of HIV are to adhere to drug regimens, promote a healthy lifestyle that includes avoiding exposure to additional sexual and blood-borne diseases, protect others from HIV, maintain or develop healthy and supportive relationships, maintain activities and productivity. In addition to these, you will also want to explore spiritual issues, come to terms with issues related to your disease, disability, and possible death, and also to cope with treatment symptoms. This has been our presentation over HIV and AIDS. We hope that you have learned something new.